Thank you for coming. This is a great system for fibrocystic breast disease since 1999. It's a result of years of research and development, and we worked super hard on it. It's a whole new way of thinking about fibrocystic breast disease based on new scientific evidence. It's an incredible system for getting rid of fibrocystic breast disease. Women are living pain-free and worry-free. How do I know women are living pain-free? I got this email. I bought Progestel about 2 months ago for severe fibrocystic breasts. I have drastically made changes in line with your recommendations. I feel almost 100% better in just a few weeks. My children have noticed me being pain-free. I couldn't hug them tight because my breasts would hurt so badly. Now they run up and give me a long, bear hugs. I can play jump rope with them that used to hurt just thinking about it. And I'm not on edge anymore. The Progestel has helped me to be the person I really am, not jacked up on estrogen. I am relaxed and much more patient with everyone. I have more energy. I am so grateful and happy. But most of all, I am not fearful anymore. Being in pain is frightening and debilitating emotionally and physically. I have spent so much money trying to find a cure for fibrocystic breasts. The bulk of the work is up to me. I am willing to do it now that I know what to do. And that little glass of Progestel is the most valuable thing in my house, besides my family. I just thought I'd share another testimony. At first, my symptoms got worse, except the breast tenderness, which seemed to improve immediately. Dr. Eckhart guided me with his advice and suggested that I first get rid of all xenoestrogens I was using and stop eating all strong phytoestrogens included in his list. Wait about a month, then start Progestel again. Within days, the sex drive was back to normal, and my breast cysts and pain had totally disappeared, so I feel like a normal and healthy person again. These emails remind us of why we do what we do. So we have 18,000 customers that take Progestel. 3,000 of these customers are fibrocystic breast disease patients. We've been in business since 1999 to 2013. We have a 90% above success rate in women that follow instructions exactly. We ship to 31 countries, including Sweden, Norway, Finland, Iceland, France, Great Britain, Spain, Italy, Greece, Singapore, Japan, Korea, Australia, Malaysia, Taiwan. So this is our product, Progestel. It's in a glass bottle with 2 ingredients, just coconut oil and USP pharmaceutical grade progesterone. This is our product. We're really happy with it and our solution. So if you have fibrocystic breast disease and not some other disease, then avoiding xenoestrogens and taking progesterone will help. Fibrocystic breast disease is painful and varies with the cycle. First, I want to talk about the hormone that mimics pregnancy, progesterone. Then, I want to talk about the cause of fibrocystic breast disease, xenoestrogens. Estrogen dominance is too much estrogen. And where is all this excess estrogen coming from? Xenoestrogens. Xenoestrogens contribute to fibrocystic breast disease. Xenoestrogens are chemicals or natural herbs that mimic estrogen, and they are strange estrogens. Progesterone can balance out small amounts of xenoestrogens. Progesterone cannot balance out large amounts of xenoestrogens. Progesterone with large amounts of xenoestrogens will make your fibrocystic breast disease worse temporarily until you stop progesterone. Progesterone is the hormone of pregnancy and occurs during the latter half of the cycle before the age of 35. Pro means for, and gesterone means gestation. So progesterone means for gestation. It is important to use natural progesterone. Natural progesterone is the same identical hormone your body produces. The fertility MDs, the test tube baby guys, routinely use natural progesterone to stop miscarriage. Natural progesterone does not cause birth defects. However, synthetic brand name progestins cause birth defects according to the physician's desk reference. Caution. Many over-the-counter and pharmacy compounded progesterone creams contain estrogenic herbs and preservatives. This is a very painful lesson I learned, and I'd like to share it with you. You have to be careful because many of the over-the-counter progesterone creams and even the compounded creams from compounding pharmacies contain estrogenic herbs and preservatives. Back in 1999, when I started treating endometriosis patients, I would tell them to buy an off-the-shelf progesterone cream. And my patients would call me back and say, "Hey doc, now I'm worse. What's the deal?" So let me explain what happened. In 1999, my 70-year-old mother had a fibroid the size of a grapefruit. She had been on synthetic estrogen. I took her off the synthetic estrogen. Likely, if I had done this alone, her fibroid disappeared. I had read John Lee MD's book, What Your Doctor May Not Tell You About Menopause, and he suggested to give her a progesterone cream to make her fibroid disappear. So, from his list of creams in the book, I bought one and sent it to my mother. After 1 month of using it, she called me back and said her fibroid was bigger now. So I began to study the particular progesterone cream I had given her. They said they had purposely put rosemary into their cream for hot flashes, and it was a phytoestrogen. So I said, "What's a phytoestrogen?" And they answered that these are plants that act like estrogen. So I went back to John Lee MD's book and got a second cream and gave that to my mother, and in 3 months the fibroid disappeared. Then I became curious about the second cream, and I went down to visit my brother in Austin, Texas, and used the University of Texas MSDS computer database to check the ingredients. I found out this second cream contains stearylcodium chloride, and 3 cc's of stearylcodium chloride taken orally causes fatal convulsions in adults. So if she ate a third of the bottle of this particular cream, she would have died of fatal convulsions. So I was shocked. And so I called them up and asked them, "How can you do this?" They answered, "We're doing nothing wrong. This is a standard cream. We mix the progesterone into it and package it." Then I started looking at department stores and found the vast majority of cosmetics and toiletries contained ingredients that are not good for you. These chemicals could either be toxic, carcinogenic, or hormone disruptive. All 3 of these are different categories. Then I started looking to the health food store. I love the health food store, but many of the products had estrogenic herbs in them. Many of the compounding progesterone creams also had parabens in them as a preservative. Now, parabens have been used for 30 years. They're not toxic, not carcinogenic, not hormone disruptive when taken orally. However, but parabens on the skin are also non-toxic and not carcinogenic. However, parabens on the skin increase rat uterate weight by 22%. So parabens on the skin made my endometriosis patients worse. And a lot of the compounded creams from the pharmacy had parabens in them as a preservative. So xenoestrogens are chemicals and herbs that mimic estrogen and contribute to fibrocystic breast disease. So I'd like to show you a teaser video from Frontline PBS about xenoestrogens. Let's roll the video.
Six years ago, marine biologists became alarmed at reports of massive fish kills on the rivers in this region. Every year, smallmouth bass were being decimated by some mysterious problem. Spring and fall, hundreds of fish would be found floating in the water, belly up.
So you see this.
I caught up with Vicki Blazer, a fish pathologist with the U.S. Geological Survey, who was trying to figure out why the fish were dying. What do we got here?
So here we have this large discolored area in the liver.
Yeah.
And then you see all these little white spots. Here's another totally discolored area.
And that's a signal of some bigger problem.
Yes, when we see a really high prevalence in a population, that indicates there's some problem going on in that water.
And when Blazer dug deeper, she found a surprise.
One of the major and most interesting findings was intersex in the male bass. When we look at the male gonads or testes, what we find is immature eggs within the male testes.
So you get sort of feminization of male fish. Is that a big, alarming finding in marine biology, aquatic biology?
Yes, and that has certainly attracted a lot of concern and attention.
Scientific studies have linked abnormal mutations in marine creatures, like intersex, to exposure to chemical compounds that mimic or imitate natural hormones in the body. These chemicals are called endocrine disruptors.
Endocrine disruptors are very, very potent chemicals at infinitesimally small quantification. I mean, you're talking about parts per million or parts per billion. They interrupt the normal way in which the body controls everything from growth and development to thyroid function to reproductive function to estrogen levels, testosterone levels. So they're very, very important, and they are a deep concern because there's so many of them now.
There are thousands of these worrisome chemicals that have gotten into the environment. And one reason is that they're part of everything we do.
The list of things that bring these organic pollutants into our bodies is a long list. And it ranges from home care products, soaps, toothpaste, cleaning agents in the household, to things we put on our lawns, the things that we use all the time, the plastic industry, the rubber industry, lubricants, fuels, the highways.
When you see scientists like Vicki Blazer cutting open fish, finding intersex in the male fish, seeing high levels of fish kills, seeing immune systems disrupted, seeing other damage to the fish, is that a warning to you potentially about human health?
Oh, absolutely. The warning not just from the smallmouth bass in the Potomac, but from amphibians all across the country. You have frogs with 6 legs, hermaphroditic frogs, male frogs with ovaries, female frogs with male genitalia. These are the canaries, the modern canary in the mine, that we haven't been paying enough attention to.
Poisoned Waters. Watch online or on air beginning April 21st.
So xenoestrogens are not only synthetic chemicals, but they are natural herbs as well. Here is a page from our free Android app about endometriosis that you can download for free. Xenoestrogens cause both endometriosis and fibrocystic breast disease. Xenoestrogens can be natural and organic as well. Pediatric endocrinologist Block, MD, in 2006